Thank you so much. I'm delighted to be with you this afternoon, and thank you for the invitation. A lot of eloquent speakers have spoken, and I also want to recognize the good work of Adriana, so I will have to leave some time for her to speak. But having said that, we've heard that diagnostics have been neglected. If there were diseases, they would be moved into the Department of Neglected Tropical Diseases. But members have recognized the great role, and I want to thank member states for recognizing this. And through the resolution of 76.5 on strengthening diagnostics. I think this is a strong recognition that flags to the whole world that this is an area that requires special attention. I want to tell you a story. Until February this year, I was the head of pre-qualification, which I led for 8 years, and I was there for 16 years. As we were evaluating what happened during COVID, one of the things that came out of the report is said, okay, we did well in vaccines, but we did dismal poorly in diagnostics. I'm not talking about the entire response. COVID response. And there were various papers that came out, and I put in one of the presentations, I asked the question. I said, okay, how much money was available for vaccines for member states to procure? And then I said, okay, how much money was available for diagnostics? Actually, to show, in pre-qualification, we listed 12 vaccines, but we listed 37 diagnostics. But how many of those were procured? In fact, what I had after some time, member states, manufacturers were saying, we are withdrawing our products from the list because ever since you listed us, nobody has procured our products. So it's a whole value chain. No single action will reverse this. And I'm glad that stakeholders led by FIND and others and Lancet Commission rallying around this resolution, we are getting together to really take the necessary action to change this word and remove this word neglect, because diagnostics are very, very important in all healthcare services, not just during pandemics like COVID we've had, but even in routine healthcare delivery. Vital for preventing, diagnosing, or managing and monitoring and treating diseases. Because not only initiation of treatment, but also monitoring progress and whether that treatment has been effective. So, and across all disease, communicable and non-communicable diseases, neglected and other diseases, its diagnostics are important. Therefore, if we are to talk about achieving universal health coverage, we cannot achieve that without diagnostics. It will be a failure, and I think we should not set ourselves for failure. Let's rally around the resolution and make sure that we take the necessary actions that we are being called upon to take in order to achieve the aspirations of the member states through these resolutions. Often we work in our own silos. Okay? Everyone wants to, they are tough and all that. But as the saying was during COVID, nobody is safe until all of us are safe. And all of us have something to play. The role is very big. There's nothing like, oh, somebody's taking over my territory or somebody's, this. We should just come together, and that's what the resolution calls upon us, to make sure that we put all our efforts together to change this period of neglect. And this needs to be across the value chain, not only from research and development. I was excited. I went to a country. I will not mention the company because I went to a country, and I was called to see a local manufacturer of RDTs. And when I went into that facility, first of all, this is in a low and medium income country. I was excited to see the level of technology that was in that. So it can happen, especially if there is technology transfer, as also called upon by the resolution. But what attracted me most was the local research they did to make sure that the RDTs they will produce, because they have not yet marketed, they will produce, are able to be used in the health system, especially those that could be stored at room temperature. Because what is commonly available is only stored in refrigeration, and the cold chain in that country is not so good. So R&D that is appropriate for the health systems that exist, so that then we can use the diagnostics that we have. But all along the value chain, from R&D to manufacturing and technology transfer, and then including, of course, production, regulation, selection, procurement, and of course, not only, my former Assistant Director General used to tell me that a very nice product that remains on the shelf is useless. It must be accessible, it must be affordable. You may have the best technology out there, but as long as it remains on the shelf and is not used. So as we go through this, we need to look at issues of access and affordability. And the issue of affordability is very important. Of course, affordability does not only mean the unit price, but also the financing mechanism that may exist to make sure that they are accessible by the health systems. Once we start talking about affordability, we also realize that health systems do not have all the funding they need. So there is a need for wise use of the little funding that is available. So selection is important. In 2027, we will be celebrating the 50 years of essential medicines list that has guided many countries on selection and sometimes reimbursement of pharmaceutical products. But for the last 6 years, we have also been producing an essential diagnostic list that also will guide member states in selecting products, diagnostics that are appropriate at the different levels of the healthcare system. So like we have had the essential medicines list, we want also the essential diagnostics list to facilitate not only procurement, but also availability and access. Now, we hope the mandate that we get from this will avoid the siloed approach and then include everybody, all stakeholders in the development of diagnostic strategies, and that integrated networks, which are major challenge globally. Because I remember when we were starting the diagnostic system, and I wanted to consult stakeholders, the diagnostic pre-qualification. That's when I saw the multiplicity of even associations of manufacturers. There's this, and this. It was very difficult to get one even voice across. So we need hope riding around this resolution will also have one voice so that we can have impact. If we speak with one voice, we will definitely have impact. I said I want to leave time for Adriana, so I have to stop here. Therefore, I would like to invite everybody who is on this panel to rally around the resolution, and we in WHO, we can declare that we will support all of you, both as a secretariat, but also in the technical capacity, to ensure that the objectives of the resolution are achieved. And with that, I can stop the the blah blah and call the technical person to speak. Adriana, over to you.
Thank you very much, Deus, and thank you all. Thank you for inviting us to this very important session. And due to time, time concerns, we will just do a little modification in the program. So we will start, I will start by calling the panelists. We have 2 panelists from member states, which we're very grateful that they are here. And we will do the interview them, and then I'll do closing remarks. Yeah. So first of all, I just want to follow on what Yodi said when she started. I really want to honor Philomena. We spent with her like 7 information sessions, fighting every single country, every single comment, everything, working day and night. So it was really amazing, and well, Philomena knows we continue this work, and that we have to keep on going for the benefit of all the population that we consider needs diagnostics. So I just want to make a note of that because that was very important. Okay, let's call Dr. Lucia Rizka Andalusia from Indonesia. Thank you very much, Lucia. Thank you. Yeah. Lucia, thank you. Can you please tell us a little bit about your position in the ministry first, and then I will be asking some questions, and if you can tell us, first.
Okay, thank you. Good afternoon, everyone. I'm Rizka. I'm a DG of Pharmaceutical and Medical Devices in Indonesia Ministry of Health. Under my responsibility, we develop the medical devices, including the IVD, and we ensure the IVD for the diagnostic, for the pre-screening, diagnostic, and the treatment monitoring available in every healthcare system in Indonesia. As my colleague mentioned, if not only in the hospital, but also at the primary healthcare and also at the POCT at the district level.
Okay, thank you, Dr. Lucia. So, as we all know, Indonesia faces some unique challenges in healthcare delivery due to its size and geography. You have put a focus on improving diagnostic testing as a means to help address those challenges. Why have you done that?
Yeah, improving the diagnostic testing in Indonesia is a strategic focus. We addressing healthcare delivery challenges due to the several critical points. The first one is the geographic disparities. Indonesia is the archipelago countries. We have 17,000 islands, making healthcare across the difficult and also particularly in the remote area and rural area. Efficient diagnostic testing can bridge the gap by providing early and accurate detection of the diseases, which is essential for the timely treatment and also management of the diseases. And the second one, early detection and prevention is very important, especially because we still have a double burden, is a non-communicable disease and also communicable disease. Let me share about our experience and our success using the improve the coverage of diagnostic for the screening of TB. In 2020, we only reached 52% of estimated TB cases modified, which accounted for the around 400,000 cases. We try to improve our effort to find the new cases of the TB and using the diagnostic tools, the very rapid screening and diagnostic. So now we can increase the case finding doubled in 2023, around 77% estimated of TB cases in Indonesia. We keep increasing the number of diagnosed TB patients being treated, aligned with the WHO recommendation. We target 100% of diagnostic be drug resistant and also drug sensitive patient receive the medication and being treated. So we need the diagnostic tools to find the new case and also monitor the treatment.
Thank you, Dr. Lucia. Today we just heard in the strategic roundtables about artificial intelligence. Can you tell us something about digital health technologies in your country?
Yes, learning from the pandemic situation has highlighted that importance of the diagnostic infrastructure and capability to support pandemic response is very important. So we increase the our activity in surveillance. And surveillance also can be success if we use the digitalization. So currently we develop the new digital information system, the big data in health sector, including we put all the result from the screening diagnostic from the primary healthcare clinics, laboratory services in the one big data. So it is easy for us to make the national health data, and we build the artificial intelligence to increase the accuracy and to faster the result of the diagnostic.
Perfect, excellent. Thank you very much. What is your perspective on the progress and challenges to implementing the resolution? Can you tell us?
Yes, Ministry of Health of Indonesia committed to implement the health transformation strategy consisting of 6 pillars. We have 6 pillars. The first pillar is the very important one, is the transformation in the primary healthcare, because we want to shift changes from the curative to the prevention. So through the activity in the primary healthcare, we improve the screening, early detection, and also immunization and education for the people to make the community healthier. And the second pillar is secondary healthcare. We have to improve the capability of the hospital, our hospital, with the very comprehensive treatment in all the diseases. We have a leveling of the hospital. We completing with the high-end technology of the diagnostic and also the treatment medication. The third pillar is healthcare resilience. In this third pillar, we have 2 agendas. The first agenda is the pharmaceutical and medical devices resilience. So our connection with the FINE and also other international organizations, very important to build the resilience in pharmaceutical, in medical devices, including IVD. And second agenda in the third pillar is surveillance. Strengthening the surveillance to respond the next pandemic, to make the very good activity in surveillance. So to build the good surveillance, we need the diagnostic, of course. Yeah. And the fourth pillar is health financing. The fifth pillar is the human resources transformation. And the last one, the sixth pillar, is the health technology. Under the health technology agenda, we built the digital transformation. Maybe my colleague present this morning, about how Indonesia wants to reach the one big data in health system. Yes, that's all is our agenda in health transformation.
Thank you, Lucia. We hope to meet again in 1 year. So what do you think you can achieve out of those 5 points that you just told us in 1 year, or what in the next anniversary of the resolution?
Yeah.
Any plans?
Yeah, actually, this agenda for healthcare transformation is in Indonesia. We start from 2022, 2022, and we now we already have very rapid result, yeah, for the agenda transformation. Yeah, we hope we can continue the agenda to make healthcare in Indonesia strengthen.
Thank you very
Yeah.
much, Dr. Lucia. We are all here to help you achieve those those
Yeah,
strategies.
thank you.
And we wish you a safe travel, that you can reach the airport on time now.
Yeah.
And
I'm sorry, I'm
and,
very
and
sorry.
really, really thank you
Yeah.
very, very much for being with us here. And you're setting an example, because with 17,000 islands, that is something difficult. How can you reach them out? The complexity of the diagnostics, the results, the supply, everything. So we're looking forward to hear from you
Yeah.
and have some more input.
And also thanks to Fine to help us to make a gap analysis, what we have to do for strengthening the capability of the diagnostic in Indonesia. So we will working closely with all the stakeholders, including WHO, of course, yeah,
Yeah.
and
Exactly.
colleague from Fine.
Yeah, we know that you hosted a workshop last year
Yeah.
with all the Sierra region and WIPRO. So really, it's been really great working with you, and we hope to support you, all of us.
Yeah.
Yeah.
Thank
you very
you.
much. A big applause for Dr. Lucia. Okay. Well, then we'll just gain back some time. Yeah. So first of all, I want to thank the Fine for inviting WHO and to be in this meeting. That's really important, and to collaborate all together. Because if we don't collaborate together, we cannot achieve exactly what Ken and Jody and everybody was saying before. It is all together we can make it. So I just have 3 messages for you. Number 1, a very important issue that was discussed over and over when we were making the resolution is that nobody from the member states wants the siloed approach. There is siloed funding, siloed equipment, siloed testing, siloed healthcare workforce, and that is not helping the world. Because if you can imagine any of us going to a health center, your baby or your son or daughter has fever, is coughing, what is it? Is it TB? Is it pneumonia? Is it COVID? What is it? And we cannot, we don't have a tag here saying I have HIV, and then I knock at the door of the HIV clinic or testing. No, so we need to build really horizontal approach, horizontal platforms. So, and there we have 2 areas. One is for the lab equipment, the lab that can be really multi-parameter platforms. And then on the other hand, and those require healthcare workforce that is trained. It requires also infrastructure. It requires energy, electricity, consumables, supply, maintenance. So that has to be there. But then on the other hand, we have innovative technologies that are exactly what you were just talking about the self-testing. So technology is going home. Now, Ken was just telling us about the grandchildren testing at home. No, so technology goes at home, and we need to ensure that is fine. Thank you very much, Dr. Lucia. Thank you. Safe travels. So those are the horizontal approach. Then the second area is that WHO continues to develop multiple information guidelines, tools, databases, and those are to help every single country. So the list of essential in vitro diagnostics actually has 39 tests for primary health care and 166 that can be used for laboratories. On the other hand, we have the priority medical devices that actually has, and I counted them today, 790 devices that could be used for diagnostics. Some of them are reagents, some of them can be a centrifuge, a pipette, anything that you need. But without that, you cannot do the testing. So they're there. And then something that happened 2 years ago is that we got the approval of the to use nomenclature and standardization of medical devices nomenclature. that is a big, it was a big gap for many years. As you all know, we have the ATCC, the INN for medicines. We didn't have any naming system for medical devices, including diagnostics. Now we have it. We're going to be using the European medical device nomenclature and the global medical device nomenclature, and those systems are already into Medevi's digital information system in WHO, and we will be having webinars about this. But this is a major input also for procurement, for regulations, for supply, for inventories, for everything. So we all use the same name. And well, the third one is, and I would like to ask the people that are helping us in the WHO task force to please stand up, because what we did, and I just want to tell you, we were asking for, we need support inside WHO to develop the task force. So it was actually Dr. Hanan Balki that said, we have the IPC, so maybe we can do something like that. And then I call for volunteers. We have Anita, Uzma, Sebastian, all of them are helping. Raúl, Mercedes, Daniela, and Elena. No, so this is very important, because the people that you see here, they're not only from headquarters. Some of them are from Lyon office. Some of them work in country offices. We have 6 regional offices, and they're all helping. And this is, besides the normal work, they are helping on the diagnostic task force. So we have about 100 and something in the list, the mapping list. Everybody that has to work on diagnostics. We all meet every month. We are sharing information. And I would like also to share with you that starting today, to celebrate the anniversary, and Danny, if you can stand up and put your, Daniela, why don't you stand up? And she's working on the advocacy team. And now we have a new website for diagnostics in WHO. So if you go to WHO, now you will find diagnostics. Yeah. So these are small steps, but just so that you know that now we're all working together. We have 5 groups. So it's the advocacy group, the work plan for the implementation, the technical issues, the resource, and country support. And all of them have been super active and providing a lot of information. We meet every 2 months, but it's not us only, the technical people, but also we're getting the senior management. So we have 5 ADGs that will be meeting with us. And we hope to get much more visibility in the future. And what we would like to do is invite you to have a meeting in a month's time, at some of them face-to-face, some online, just to make sure that we now invite all the NGOs, the non-state actors, the industry that are here, many other of the non-state actors, to see how are we going to work together. So with that, I will stop. But what I wanted really is to thank everybody, and so that you know that we're really working on all the requests that were in the list. We'll do what we can, but we also need all your support, because WHO cannot do it alone. Even if we have so many volunteers, we really need your help. No? So we hope that we can continue working towards better diagnostics for patients, because that is what drives us all here. It's not the technology, it is the patient. And we need to work for patients. Thank you.